disorders. It's the 11th leading cause of death for all ages. Third for 15 to 24-year-olds. Second among 25 to 34-year-olds. You know, and it's typically it's not about hurting other people. It's about making the pain stop for themselves. They just think their friends, their family will be better if they're gone, because then they're not being hurt by seeing them sad and depressed all the time or worrying about them, you know. So they're trying to be self-conscious of the people around them by committing suicide. They just don't understand, you know, the repercussions. 50%. So 50% of your suicides, they have either a depressive disorder or bipolar. And almost always, it's if they have bipolar, they're in that depressive cycle. Drug and alcohol abuse 25, schizophrenia 10, personality 5. So most of your suicides, your suicidal people, are going to be right here. In the month prior to death, 50% of suicide decedents had received healthcare services. So half of the people that successfully completed suicide in the last month had seen a doctor, a nurse practitioner, a therapist, somebody in healthcare. Could they have been stopped? It's possible. Talking about suicide with someone who is suicidal is not going to make them commit suicide. They're already thinking about it. You don't have to put the thought in their head, okay? So just be upfront. And the best way to talk about it is just be like, dude, are you suicidal? Are you thinking about it? Do you have a plan? No, you can say, well, I noticed, you know, you don't look yourself, you know. Is there something you want to talk about? You know, is there anything I can do? You know, just make yourself available. Give them some resources. Give them the suicide hotline number.